Welcome to Blocking the Flame, Anakinra and COVID. I'm Gaganasri, your host for today's episode. With a background in bioinformatics and computational biology, I've always been fascinated by how data and real life stories intersect. Today, we are stepping out of the sterile walls of clinical trials and into the bustling hospital walls and clinics where real world evidence and case reports breathe life into our understanding of Anakinra. Think of it like observing a medicine in a greenhouse versus watching it grow wild in the forest. Clinical trials are the greenhouse, controlled and structured evidence, while real-world evidence is nature in motion, messy but full of insight. Joining me today is Aseema, a microbiologist with a solid foundation in biotechnology and a deepening passion for gut-brain axis. She's been closely following the real-world use of biologics like Anakinra in COVID-19. Asima, welcome. It's always a pleasure to have someone so grounded in microbial systems and systemic health join the show.
Thank you so much, Gaganasri. It's truly a pleasure to be here. And I think this topic, real world evidence and case reports, is really crucial because it reflects how therapies like Anakinra operate outside the theoretical framework, that is, in the chaotic reality of pandemics and immunological uncertainty.
Beautifully said. So let's dig in. We often hear about randomized control trials, but could you walk us through how real world evidence and case reports complement that data? What's the microbiological equivalent here?
Yeah, absolutely. So, if clinical trials are like petri dishes, controlled, isolated environments designed to reveal specific interactions, then the real world evidence is more like a full ecosystem. You see how the drug behaves amidst the complexity of comorbidities, patient behavior, and variations in the care settings as well. And RWE, that is the real world evidence, includes aggregated data from real patients, those who may be older, immunocompromised, or have other underlying conditions that trials often exclude. Meanwhile, case reports are like single case studies in a microbial lab, one organism, one culture, and one unique outcome. They provide depth over breadth, often flagging unexpected results or novel therapeutic uses. And together they enrich our understanding of anakinra's potential and its limitations as well, especially in a disease as dynamic and systemic as COVID-19. You need that whole body perspective.
Okay, that makes perfect sense. It's like looking at a single neuron under a microscope versus watching the whole brain light up during a cognitive task. Both are crucial, but they tell different parts of the story, right? Now, focus on Anakinra. What have we actually learned from real world use? Are there any specific patterns or patient groups that seem to benefit most?
Yes, real world data has consistently shown that anakinra tends to be particularly effective in patients facing a cytokine storm, this hyperinflammatory reaction that mirrors conditions like secondary hemophagocytic lymphohistiocytosis. Hospitals have reported that patients with elevated markers like CRP, ferritin, and IL-6, especially those with comorbidities such as diabetes, obesity, or chronic hypertension, tend to benefit when anakinra is introduced early. Interestingly, anakinra has also shown a stabilizing effect in patients with autoimmune predispositions. Its targeted inhibition of IL-1 seems to dampen that systemic fire before it consumes critical tissues. And real world use reveals that the drug's capacity to adapt to complex host conditions, something trials often sanitize away.
That's like watching a firefighter not just douse the flames, but also prevent flare ups in hidden pockets. Now, let's zoom in on case reports. Have there been any that particularly stood out to you?
Well, several actually. One that stayed with me involved a middle aged woman with poorly controlled type 2 diabetes who developed severe COVID 19 induced myocarditis. Her inflammatory markers were through the roof, and organ failure was also setting in. And after receiving IV anakinra, her condition stabilized remarkably within just 72 hours. and that was a turning point in her case. Another report described a young man with lupus who developed COVID 19 induced macrophage activation syndrome. Traditional immunosuppressants failed, but Anakinra administered early and in high doses helped control the storm. And the improvement was almost, textbook. These cases, while anecdotal, shed light on Anakinra's potential in immunologically complicated scenarios where the patient is not just fighting a virus but also an overzealous immune system.
That's incredible. It reminds me of tweaking parameters in a complex model. Sometimes one adjustment can reset the entire system. What about patterns in patient responses? Can anything help predict who might benefit the most?
Well, yes, there are some discernible signals. First, timing is everything. Administering Anakinra early before irreversible organ damage greatly improves the outcomes. And once the inflammation has caused structural damage, its ability to reverse that course diminishes. Second is high levels of IL-1 linked inflammatory markers suggest a better response to anakinra since it directly targets the IL-1 signaling. And third, comorbidities matter. Inflammatory baselines such as those found in metabolic syndrome or autoimmune conditions often indicate a more IL-1 driven pathology and therefore greater benefit. But it's not a universal solution. In patients where viral load, not inflammation, drives the symptoms, antivirals remain primary. Anakinra is not a hammer for every COVID nail. It's more like a scalpel for the inflammatory subset.
That's a powerful analogy. A scalpel, not a sledgehammer, which is precision over force. Looking ahead, what do you think the future holds for Anakinra in the post pandemic world? How might real world data shape its role?
Well, I think we are moving toward a more nuanced use of biologics like Anakinra. As real world data sets expand, especially with AI driven analysis, we'll likely see more stratified treatment models, algorithms that guide therapy based on a patient's inflammatory profile, genetic markers, and comorbidities as well. Also, we are beginning to see interest in Anakinra post viral syndromes. Think long COVID and persistent systemic inflammation. There's an exciting possibility that this drug could help recalibrate immune dysfunction long after viral clearance. In short, Anakinra's story is still unfolding, and real world evidence is the narrative thread that's tying it all together.
That's such an insightful way to frame it. The data isn't just static. I feel it's alive, dynamic, evolving like a microbial culture in response to its environment.
All right.
Asima, thank you so much for joining us today. Your microbiological lens really helped us see the whole terrain of Anakindra's real world journey, especially for patients who don't fit the clinical trial mold.
Thank you, Gaganasri. It's always rewarding to, translate scientific complexity into meaningful dialogue. I'm hopeful that with time, we'll continue to refine our tools and our empathy in treating diseases like COVID 19.
Well said. And to our listeners, thank you for being part of this ongoing exploration. In our next episode, we'll be navigating the frontier of next gen IL-1 modulators and their potential in post viral and chronic inflammatory syndromes. Think of it as the sequel to Anakinra, sharper, faster, and maybe even smarter. Until then, stay curious, stay compassionate, and stay safe. You'll be listening to Blocking the Flame, Anakinra, and COVID. See you next time.